The National Pharmacare Committee of Experts made recommendations today on how to improve Canadians' access to medicine.
The evidence is clear. We need to reform how we distribute, how we access prescription medication, and it is urgent. This affects everyone in our healthcare system. It affects patients, families, providers, communities, and the long-term sustainability of our public healthcare system.
The pharmacare experts recommending putting federal legislation in place that recognizes access to essential medicines as a human right. That the feds should maintain a list of essential medicines and put their best effort forwards to keeping those medications publicly funded. With me now is Stephen Staples, the National Director of Policy and Advocacy for the Canadian Health Coalition. Stephen, thanks for being here.
Morning, Matt.
Let's get into this too right now. First of all, can we start with, the state of the pharmacare program as of right now? Legislation, came into effect, but where do things stand as of this point before we get into this essential medication conversation?
Well, I think as one of the experts on the committee started the press conference by saying, our work is not done. And I think she was right on that. The program was started about a year ago, and in that brief time period afterwards, 4 provinces and territories signed agreements with the federal government to begin to receive money to cover 2 classes of medications. That's diabetes treatments and related products and contraceptions. But only 4 out of the 13 provinces and territories, and it seems to have stalled. So 3 were signed under the Trudeau government, 1 agreement with Yukon was signed under the Carney government, then the election hit, then we've had the budget, and there's been no new agreement signed. So this kind of leaves us in a weird situation where 4 out of 5 Canadians don't have access to this highly touted, very popular federal program, and there's a lot of questions as to what's holding it up. And I think this panel, this report, comes at an excellent time because they're trying to put forward some practical solutions to get the program moving forward again, to get essential medicines into the hands of Canadians.
Yeah, you talked about some of what took away from it too, right? That, the election, but the budget. Now, Mark Carney did commit to keeping the pharmacare program intact. Take us through some of these solutions, some of the recommendations by the experts today, and particularly the couple, again, when it comes to essential medications that might be so vital.
Yeah, well, I mean, these are medical experts, so top of mind for them. There's a pharmacist, there's a doctor, there's a nurse. They're looking at patients. How do we help patients? And I've talked to doctors myself that have said they're seeing people in the emergency room that have not been able to afford their medication, that have not been taking it, and their conditions are getting worse. So there is a real crisis. There's an access crisis there. So they're trying to deal with the medical situation. And that comes really strong by asking the federal government to pass a new legislation to saying that the right to essential medications exists in Canada, that it's a right to that. I mean, you remember the Prime Minister, he said health care is a right in Canada during the election. Well, let's make that a little more specific on essential medications. But then there's the political and, of course, the economic element to it as well. And they're putting forward solutions saying that, look, the fact that it stalled, apparently, in terms of bringing on more provinces and territories, why doesn't the federal government just go it alone? Look, they could just go ahead with the program now, work with the provinces, and just accept the receipts for any essential medications by a list, and give the money to the provinces to pay for that. No need for complicated negotiations, and we could have a national program there. And the third thing is the budget. They noticed that the federal budget only mentioned pharmacare once. They didn't put any more money on the table in the budget. The original budget passed last year has been about spent 60% of it, or I'd say, yeah, about a little over half of it has been spent in these just 4 agreements already. So more money is needed to expand more provinces. More money is needed to increase the list beyond the original 2 to move forward to other medications. And they say that, well, there is a bit of a price tag to that, between $6 billion and $9 billion per year to make that program operate the way they're describing it.
Okay, we'll see what happens. Stephen Staples, National Director of Policy and Advocacy for the Canadian Health Coalition. Thanks for this, Stephen.
My pleasure, Matt.